It has become one of the most expensive measures on the November ballot. Ads for and against Proposition 8 have taken over TV, radio, and the internet. Prop 8 would cap the profits of dialysis companies. Each side has a different view on how that would affect patients' lives. KTVU teamed up with San Francisco-based By the Bay to go through all those commercials that you're seeing and break down claims both for and against Prop 8.
Yes on 8. Because kidney patients deserve better.
Join medical professionals and experts in voting no on Proposition 8.
Prop 8 is specific to dialysis clinics, which serve nearly 1 million kidney disease patients in California every year. If passed, the measure would limit those clinics' revenue and require them to issue refunds for anything exceeding that limit. If that sounds obscure to you, our expert says there's a reason.
It's actually a battle between the labor unions and these dialysis clinic companies. The labor unions essentially had put Prop 8 on the ballot because since 2016 they've been trying to unionize all of these dialysis healthcare companies, and so what they've realized is that they can go through the legislative process and put ballot propositions on the ballot in order to kind of gain leverage.
Both sides have poured tens of millions of dollars into their campaigns.
Prop 8 ensures vulnerable patients don't get ripped off.
The Yes on 8 campaign was funded mostly by the SEIU United Healthcare Workers West. The group claims the measure protects workers and patients and stops dialysis companies from overcharging, which would bring down the cost of health care premiums for everyone. But our expert says that result is uncertain.
It's hard to predict how these dialysis clinics will react to something like Prop 8 and how they manage their books.
The No on 8 campaign is funded by California's 2 largest dialysis clinics.
Because it will cause dialysis clinics to cut back services or shut down.
They say Prop 8 jeopardizes access dialysis patients need to survive and increases costs for all Californians by hundreds of millions of dollars a year. So, is that true?
Not directly. It would have to be like a secondary effect if these dialysis clinics were to actually close. And then somehow the state would have to absorb those closures.
Okay, so will Prop 8 improve dialysis care or reduce access? Here to debate is Dave Reagan, president of SEIU United Healthcare Workers West, which of course sponsored Prop 8, and Kathy Fairbanks, a spokeswoman for opponents of Prop 8. Thank you both so much for being here.
Thank you.
Dave, I'm going to start with you. How will this make things better for patients?
Proposition 8 will do 2 basic things. The first thing it will do is it will dramatically reduce the cost of dialysis services for patients across the state and undermine this really predatory business model that the dialysis industry has. And secondly, it's going to create incentives to improve staffing and improve treatment at clinics across the state.
Kathy, you represent 2 of the biggest dialysis companies. They see things differently.
And it's our coalition of more than 160 groups that see things differently. Under Proposition 8, insurance companies will pay lower reimbursements to dialysis clinics. These lower reimbursements will not allow clinics to cover their costs, and ultimately they'll be forced to close. This, of course, is bad for dialysis patients. They need dialysis in order to stay alive.
You really mean to tell people that if this passes, dialysis clinics will close for good?
The initiative is so draconian and so severe that instead of reimbursing clinics for 100% of their costs, Proposition 8 only reimburses clinics for 69% of the costs. It omits costs for the physician medical director. 2 RN positions at clinics aren't reimbursable, aren't considered allowable under Proposition 8. This is why the California Medical Association, the American Nurses Association, ER doctors are concerned about Proposition 8. If clinics close, dialysis patients will have nowhere to go. They'll end up in the hospital emergency room where care is far more expensive.
Okay, you hear what Kathy's saying there, Dave. She says it's going to be difficult for these dialysis clinics to stay afloat.
Yeah, that's not true, and Kathy knows it's not true. And the statistics she cited were statistics that were produced from a consulting group that was paid $200,000 by her clients to give them the answer that they wanted. But more importantly than that, this is a business model where if you are a Medicare patient, which is the vast majority of patients who receive dialysis treatment, a typical treatment costs $250. If you are being insured through private insurance or job-based insurance, A typical treatment costs between $1,000 and $1,250 here in California. That's the business model. That's why Fresenius and DaVita made over $4 billion in profits just last year alone, and that's why in the last 5 years, DaVita, one single company, one provider, has been hit with legal judgments and fines of $1.3 billion for price gouging and poor care
Okay,
across
Kathy,
the country.
you got to respond to that. He's claiming that employees are overwhelmed, they're exhausted, that the centers are providing below adequate care.
That is not true. That is a misrepresentation of what's happening in dialysis today. Clinics in California outperform the national average in patient quality, in patient satisfaction. California dialysis clinics have a 16% lower infection rate. The main problem with Proposition 8 is that this is an initiative that shouldn't be on the ballot. The groups that are opposed because it's going to endanger patients' lives. It's going to raise healthcare costs. This is why every newspaper editorial board is opposed to Proposition 8. They've called out concerns about higher healthcare costs. That came from the LA Times. The Chronicle said this is a measure that does not belong on the ballot. It's pretty widespread that the higher healthcare costs really are going to impact everyone in California, whether you have a family member on dialysis, whether you know someone or not. Putting patients in the emergency room to get dialysis care isn't where they should be. It's going to raise healthcare costs, and it's going to endanger patients.
So earlier this week, Heather, two major healthcare providers in California, including Kaiser Permanente, in a written report to the City of Los Angeles retirement system, said Proposition 8 passage on November 6th will result in absolutely no access problems. This is fear-mongering. Kathy's clients are going to spend about $120 million to try to scare voters across California and convince them that they should be able to continually mark up treatments 4 to 5 times more than what Medicare pays for people across the state.
Kathy, is this fear-mongering?
No, this is not fear-mongering. And as an example, Dave mentioned Kaiser. Kaiser, is not in support of Proposition 8. You'd think that all the insurance companies would be in support of Proposition 8. If Prop 8 lowered healthcare costs, as the yes side claims, you would think that all the insurance companies would be in support. They're not, because they can look down the road. They see that the clinic closures will result in them paying more for patients who are sicker, more for patients who are getting treatment in the hospital emergency rooms. And it's not good for patients. It's not good for anybody.
We're just about out of time. Dave, you've got about 15 seconds. Your final pitch to voters out there on Prop 8.
Look, health care is just too expensive, and voters across California know it. And dialysis is the worst example of outrageously priced health care in California. They're like the payday lenders of the healthcare industry. They're charging people 4 to 5 times more, $4 billion in profits, a CEO who makes $15 million a year, and it's time to put caps on how much we're going to get price gouged by DaVita, Fresenius, and other dialysis providers in California.
Okay, Kathy, same thing.
I think if anyone is misrepresenting, it's Dave. This is a really bad initiative. And as I said, we've got the support of the medical community on our side. Don't listen to me. Listen to the California Medical Association, representing 43,000 doctors in California. Listen to the American Nurses Association, which is strongly opposed. Emergency room physicians are also strongly opposed to Proposition 8. They don't want to see this pass, and they understand what will happen.
All right.
The domino effect.
We're going to have to leave it there, folks. Thank you so much, Kathy Fairbanks, Dave Reagan. Appreciate you coming on to debate Prop 8. And a reminder, on KTV.com, you'll find everything you need to know for the upcoming November midterm elections. Again, it's on KTV.com.